Sujata Dwivedi is also joining us at this point from Mumbai. Sujata, if we talk about Mumbai and Maharashtra, what is the situation? COVID numbers continuing to rise. What is the government and the state health ministries saying?
Well, Uday, if we talk about Mumbai, then we know that this is the hot spot for the rising COVID cases, and also Maharashtra is one of the leading contributors of the daily COVID cases that are recorded in India. And talking about the previous records, in the last 2 days, the number of the daily COVID cases in Maharashtra has crossed 1,000 mark. It means that in Maharashtra, all over, more than 1,000 cases were registered, and more than 14,000 tests are being conducted daily. And if we talk about Mumbai, then it is being said that more than 900 cases which were already prevailing here, and now the numbers have gone up to 300 cases in Mumbai the last day, and out of there were 9 deaths that were reported, and out of that 2 were from Mumbai, which were of course senior old citizens who were who were fighting with some lung disease or with the illnesses. Now the government, if we talk about, as we know that the COVID has been a major concern for the government, because in the recent times it was declared as a hotspot for people, where we saw that they were they were asked to wear masks. And not only that, but we also know that now for the BMC hospitals, for the government hospitals, mask has been made mandatory for the staff as well as the patients who are visiting. Apart from that, people have also been advised to wear masks and also maintain social distancing whenever they go at such public places or crowded places. Now, while we had a discussion with the officials of the Health Ministry of Maharashtra, they have to say that these cases will continue to rise till May, because of the mid hump that are often seen during the week, or during the weekdays is a major contributor for the rising cases. And as Manohar mentioned that there were the mock drills that were conducted at several hospitals in Mumbai as well, be it the JJ Hospital or St. George Hospital or Seven Hills Hospital. These mock drills were conducted to find and gauge the preparedness of the government as well as the hospital, be the availability of beds, of medicines, or the staff for the treatment of the patients. Because as of now the situation is under control, and the ministry has said that it will be, because patients are often reporting asymptomatic, they are getting asymptomatic symptoms, which is why they prefer staying at home, isolating themselves, taking meds, and then curing the illness. However, there are some patients who think they need treatment, which is why they prefer going to the hospital and getting admitted, which is why these beds are being made ready and available for them. Apart from that, as Manohar also mentioned, that the medicines are being made available. As of now, no vaccine in Maharashtra. We had a word with them. They have clearly stated that the central government, as of now, there is no stock of vaccines. However, it will soon be made available for the people, be it the booster dose or both doses of vaccination that people have not taken yet. Apart from that, the state health ministry is also holding meetings with the government hospitals and discussing about what further actions can it be taken. However, advisories has been, they are being continuously released out for the people as well as for the hospitals, where people are being advised to wear masks as well as maintain social distancing. And also, if we talk about the areas in Mumbai, because Mumbai is the hotspot in Dadar, Lower Parel, and the area that goes towards the suburban sides. These are a major hotspot region for
Yes.
the COVID cases to rise. So they
Dr. Ishwar
all
Gilada,
these
health expert, is also joining us at this point on the broadcast. Dr. Gilada, should this be looked at as an endemic now? That's what our sources are telling us, or are we still a while away from that?
We are already in the endemic stage for last couple of months, and I don't know why the government is shying away from declaring. We are just following WHO blindly. Secondly, with any kind of surge, we need not be worried, because this surge is only in infections. It is not leading to oxygen demand or hospitalization, and deaths are proportionately less than earlier. So if there has been an increase in 80% or 90% cases, deaths are increasing by 40% or so. Having said that, only those people who are at risk are those which are with severe comorbidities and elderly population. And they need to be protected. In Maharashtra particularly, only 15% of the people have taken the third dose, as against the national average of 30%. So, and now at most of the government places, no vaccine is available. Only at 2 places in the city, which are private setup, the vaccine is available. So when we talk about fighting with any kind of calamity, our preparedness is falling short of vaccination. And that is a pathetic scenario. We have had to destroy close to 10 or 11 crore vaccines. There has not been a proper planning in vaccination and usage of vaccine. So I think we have to have a good forward-looking strategy. Secondly, vaccine should be made available at all private doctors. It need not be rationed only at the few designated centers. When a doctor can use any vaccine, giving any vaccine like even flu vaccine or pneumovax vaccine or hepatitis B vaccine, typhoid vaccine, why they can't use this kind of vaccine which is COVID vaccine? So initially it was emergency use authorization. We are not sure of the vaccine's effect or side effect. We are not sure whether it will be properly used or it will be wastage. But now we know that the scenario is endemic. And anybody who is interested, we should be able to take vaccine at a stone's throw distance. They need not go for wait and find out the vaccine is not available. So, and mandate for the masking is not required. What is required is a requesting mask. Request those people who have any kind of symptom like running nose or a cough, even once also they should use mask. And those people who are at higher risk, which are comorbidity people, they should use mask for not getting infected from their near and dear ones. So people, those who are visiting them because they are sick at home, they should be using mask or the patient should be using mask.
Right. Sujata, let me, quickly come back to you at this point on, the situation, of course. Does it require a mask mandate? Is that something that Maharashtra government is looking at? Okay, I'm being told we've lost Sujata's connection there. Let's try and go back to Manohar if he's with us. Manohar, is a mask mandate being looked at by the Health Ministry? Also, is there a plan to encourage, citizens to take their booster dose if they haven't taken it as yet?
देखिए, बिल्कुल हेल्थ मिनिस्ट्री की ओर से ये कहा गया है कि अगर आपको ज़रूरत है तो मास्क लगाएं, आपको अगर सिम्टम्स हैं तो फिर मास्क लगाएं। मैंडेट नहीं किया गया। हालांकि अगर हम दिल्ली एम्स की बात करें तो दिल्ली एम्स में सारे स्टाफ्स को ये सर्कुलर जारी करके कह दिया गया है कि आप जो है सो मास्क लगाएं, क्योंकि अभी दिल्ली एम्स में भी करीब 1 दर्जन से ज़्यादा लोग जो हैं सो कोविड के चपेट में आ चुके हैं, जिसमें से 4 डॉक्टर्स हैं और उसमें भी एक फैकल्टी शामिल है, कई स्टाफ्स हैं। तो ऐसी स्थिति में जो प्रिकॉशंस की बात होती है, प्रिकॉशंस लेना बेहद ज़रूरी है और खास करके दिल्ली के सभी अस्पतालों में कह दिया गया है कि आप जो है सो कोविड प्रोटोकॉल का पालन करें।
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.